Pain physicians see more than 40 patients a day in up to 10 to 15-minute appointments. But 95% of pain patients aren't treated by a pain specialist. In fact, they're treated by an internal medicine or primary care doctor who has less pain training than a veterinarian. Hi, my name is Rachel Trobman, and I'm the CEO and co-founder of Upside Health, where we're using technology to transform the way that chronic pain is assessed and treated. I'm part of a compassionate group of individuals who are passionate about changing the face of pain care. In fact, I started this business after my personal challenges communicating around pain, but it wasn't until this company has launched and grown that I've been able to see how truly broken pain care is, and together with my colleagues, how urgently it needs fixing. And the problems with pain are documented and growing, not just for the 50 million Americans who live with pain, but for all of those who treat them. Pain physicians see more than 40 patients a day in up to 10 to 15-minute appointments. But 95% of pain patients aren't treated by a pain specialist. In fact, they're treated by an internal medicine or primary care doctor who has less pain training than a veterinarian. And we are uniquely suited to solve this problem. In fact, we've served more than 32,000 patients to date, have collected more than 10 million data points on the pain patient experience, and have even driven more than $640,000 in new revenue to our clients in under a year. And we do this through our product, Branch Health. Branch Health offers unmatched insights through more actionable, dynamic, actionable, accurate, and dynamic pain assessments using both structured and natural language, as well as providing access to care for the components that physicians are undertrained, undercompensated, and don't have time to deliver, as well as de-risking and providing new revenue generating opportunities through CPT codes and providing monitoring for the highly risky chronic opioid therapy patients. Patients are enrolled in our program through their physician, and after analyzing the patient's individual pain experience, we're able to dynamically support them through a combination of live and pre-recorded self-management tools. Each patient is also assigned a dedicated nurse who follows their journey each month. All of this data is then automatically entered back into the physician's EMR as a billable encounter. Since January, we are also able to drive superior outcomes. 30% of our patients were able to statistically significant decreases within their morphine equivalency within 3 months of our platform. And 6% of patients who are enrolled in Branch Health were able to avoid ER visits. And we're seeing that number grow month over month. And since January, we've been seeing record growth. We've been bringing on 2 new clients a month at 125% month over month revenue growth through both new deals and increasing penetration in our existing clients. We currently have clients in 10 states, primarily physician-led practices, as well as relationships with 2 MSOs and 6 EMRs, including our star partnership being Athena Health. The future of our company lies beyond serving just pain practices, and instead allowing any provider who is treating pain patients to deliver cutting-edge pain care. We'll do that while increasing profits, and at this rate, we'll be cash flow positive by the end of this year with a clear path to over $3 million in revenue by next year. To support this growth, we're raising $1 million seed extension with commitments from our existing investors. I look forward to your questions and seeing how we can change pain care together. Thank you so much.
Rachel, amazing presentation, and you have such great momentum. Building a company in this environment is certainly challenging times, but when we take a look at your track record right now, what do you think is accounting for all of the recent wins?
Yeah, I think a lot of the recent wins can be attributed to 2 things. One is just our presence in the market. And the more EOBs, the more documentation, the more data that we have on both our program's effectiveness and the path for profitability for our clients has really helped our success. And secondly, the deep integrations that we've built with the EMRs, which make our clients more confident to get started, and the quickness in the way we're able to deliver value.
How are you getting most of your clients right now? And what does the sales cycle look like in the pain management space?
Yeah, we've really been able to shorten that sales cycle. We're looking at between like 2 to 4 weeks from the time of introduction to close and launch. And we attribute that again to the deep EMR integrations, but also to the real need that we're serving. I mean, I run an educational webinar and inform these small to medium-sized physician-run pain practices, ortho practices, around how they can de-risk and demedicate, safely prescribe and safely treat these patients through our program. And the response is almost unanimously yes. And the fact that we can do that without increasing their clinical strain really adds to that value.
So Rachel, we have some great questions coming in from the audience. The first one is, thanks for the presentation and congrats on the success and impact. How much has been committed so far in your seed extension, and do you have a lead investor?
Yeah, it's great. Thanks so much for asking. Our existing investors, Hearst Lab, Beta Boom, Bayer, Cedars have all expressed interest in participating. We were going to run this as a convertible note with a $10 million extension, a $10 million post money. We just launched this, I think last Friday, so less than a week ago. And so we're just starting this process, but we're fairly confident that we can move towards a quick close, not a slow close. That would be not ideal.
Yeah, no, so totally get that. And great to hear that the process is recently launched, and looking forward to getting the update from you in a little bit. There's another question from the audience, from Esther Dyson. What kinds of pain do you focus on? Is it acute or chronic? Musculoskeletal, cancer? Are there other types? Is there a point of focus?
Great question, Esther, and thanks. It's great to see your name there. We primarily focus on chronic pain, particularly complex chronic pain. The majority of our patients have multiple comorbidities. The cause of cancer or the cause of pain is less important than the impact that that pain has on their lives. And so we have a lot of patients with post-treatment cancer pain, a lot of patients with non-specific back pain, and then, of course, the more complicated pain conditions like RSD, CRPS, fibromyalgia, migraines, et cetera.
So Rachel, we always love to, connect the companies with the founder's actual story. Like what prompted you to start this business?
Yeah, so I was fortunate enough to have a pretty senior role building products for media companies, and was very confident in my ability to build products from ideation to execution. But I really dealt personally with a lot of challenges from both a patient perspective and a care coordinator aspect of both. My mom has lupus and my brother has cystic fibrosis. And so growing up, I spent far too much time in doctors and hospitals. But I had a really unique lens when I started encountering health conditions myself, and realized that one of the biggest pain points was really around pain care, pain communication, and having access to the resources at scale. And so that's where this company has come from. And it's only been through the growth of this company that I've learned that this was not just a patient problem, but truly a systemic one, and something that needed a big solution. And so I've been thrilled that we've been able to play a small part in making this large change.
Okay, Rachel, we've got one final question from the audience. Are there any devices, digital health or digital therapeutics, that are connected to your method? And if not, any interest in new ones potentially being added or going down that path?
Yeah, so the product, the Branch Health product, in and of itself can be constituted, software as a medical device. We've worked with other digital therapeutics and devices for data collection, and we'll continue to expand that offering as we grow.